recognized now for 1 minute.
Thank you. This amendment takes us in the wrong direction. For years, people serving in the military who are openly gay, lesbian, and transgender. And they have served and served this country well. For a lot of years, we did not allow them to do so openly. We finally repealed that for lesbians and gays, and now just last year, we had the Department of Defense say we're going to do the same thing for transgender. So the people who have been fighting and protecting our country will be allowed to do so openly. It does not harm readiness at all. These people have served in the military, served it honorably, and served it well. As far as the costs, the military pays for people who have addictions, who have alcoholism, who smoke. They pay for a lot of things that are contained within the military. This amendment would target one specific group, and very unfairly, and most unfairly, it wouldn't just, first of all, target transgender surgery. It would target some of the hormone drugs, which cost like $100 a year, cost absolutely virtually nothing to the military. But most importantly, this wouldn't just impact transgender. I yield myself an additional 30 seconds. This wouldn't just impact transgender people who are serving. It would impact their children. If you're serving in the military and you happen to have a child who is transgender, you would now be cut off from this military service. All these other things, alcoholism, drug addiction, smoking, all manner of different problems would be served, but transgender people would be targeted to not be allowed to provide health care for their children. This isn't going to help readiness. This is a social agenda that has no business being in the defense bill. We didn't have it in committee. We shouldn't have it here on the floor. Let's focus on the threats that Ms. Hartzler talked about, not make this into a social agenda based on the ignorance of what transgender truly is. I reserve the balance of my time.